Hi everyone. So this week's discussion question says, describe how this week's PowerPoint changed your understanding of drugs and their beneficial effects. Did you ever consider how drugs are behaviorally active? And what did you find most interesting about the lecture? So I have never really thought about the drugs being actually behaviorally active. Whenever I think of drugs that are used for kiddos or clients to help with modify their behavior, I just always think about, the side effects that the drugs may have on them, such as, if a child starts taking Risperdal for their mood and all of a sudden their mood decreases for that because it's stabilizing that mood. I never really thought about how the drugs are actually conditioned, can be a condition, and also a conditioned stimuli, and then also the antecedents such as the SD and the MO, and there's also a consequence. So whenever I've thought about drugs, I just thought about a kid taking drugs, taking the medication to help manage their moods, help with the anxiety, help with just basically what it's helping in general rather than the behavioral analysis side. So I really thought this week's presentation was very interesting. It was very educational. I learned quite a bit because usually whenever I think about drugs and pharmaceutical and how they all play, I think about mostly, thinking about the side effects the drugs may have, but not, like I said, thinking about how it is a conditioned stimulus and what is the motivating operation and the consequences of the drugs that it would have on the behavior in that way. I just have always thought of it of the different way and just those facts. I feel like that was probably one of the most interesting things I found, but also something I seem to have a better understanding of overall. So for this week, I just really thought just learning about that and just getting that better understanding and seeing it from our point of view from the behavior analysis perspective. Because like I said, whenever with our kiddos, whenever they get put on a different drug, because a parent might say, this drug is not working, so we want to change our meds because we've heard that this drug might be better for the behavior that they are presenting to us or presenting to the parent. So then they just continue to change the drugs till they finally, so the parents fix the behavior. As we all know, drugs don't fix the behavior. It just might help decrease some of help decrease moods, maybe help reduce the anxiety of somebody. But that's what I've always thought about whenever we talked about pharmaceutical and drug management and just in general. So overall, I really thought this week's PowerPoint was very informational. It was interesting and nice to kind of think about how behavioral analysts look at drugs and how they have an effect on the behavior itself and the consequences and the antecedents and the conditioned stimuli. I just feel like that's just very interesting from our perspective because I feel like a lot of other people don't really see it from that perspective. So learning about it, I felt was good, and I'm curious to learn more about the drugs and how they have the effect on behavior and how, more behavior analysts see behaviors in those three areas, how they look at it in the form of someone taking drugs to help manage those moods and looking at it from a different lens rather than other areas and other fields and parents out there. So, thanks.